Tyler Harrison, and I'm a first year Master's of Public Health student. This is episode 4 of the MSM Legend project where I'm interviewing Dr. Rivers. Dr. Rivers, I'm so excited to be speaking with you. Please tell me and the MSM community about yourself and what you've been up to since you graduated from the MSM MPH program.
Well, great meeting you as well, Tyler. And I'm glad to be having this conversation with you. So I'm Brian Rivers. I'm a graduate of Vanderbilt University. My major was in biology. From there, I actually matriculated through Morehouse School of Medicine. I think I was a part of the second or third class of the MPH program at the time. Yes, I have a little age on me. And I graduated in 2000 from the track Social and Behavioral Sciences. From there, I matriculated through to a PhD program at the University of Alabama at Birmingham School of Public Health, where I focused a lot of my efforts around health behavior and health promotion. I really began to sort of launch into health disparities research. From there, I completed a postdoc at Texas A&M University at the Center for the Study of Health Disparities. I was funded through the National Institute on Minority Health and Health Disparities at the time. And during my postdoc, I got recruited to Moffitt Cancer Center, where I served on the faculty for 10 years prior to being recruited to Morehouse School of Medicine by President Montgomery Rice. At the time, I think it was around 2013, 2014, Dr. Montgomery Rice and I served on the National Advisory Council for the National Institute on Minority Health and Health Disparities. It was during that time I learned about her dynamic leadership and her vision that she had for the institution. And given my passion, related to health disparities and health equity, just thought it would be an outstanding fit and it was perfect timing for me to make a transition back to Morehouse School of Medicine, but this time as a faculty member. And it was also good to be home. I'm a product of Atlanta Public Schools. I went to Collier Heights Elementary. Back then it was K through 7. And then from there I went to Frederick Douglass High School, which was 9th through 12th at the time. So yes, right down the street from Morehouse School of Medicine. And then from there I started my education journey, mostly in the southern states, as you would note. Yes, I like warm, but I'm definitely glad to be back in the Atlanta area doing this work under the dynamic leadership of Dr. Montgomery Rice.
Wow. You've done amazing things, it seems like, since you graduated. But I want to take you back to your time as a student.
Sure.
So, how did you decide to get your master's in public health? And how did you end up choosing Morehouse?
Sure. So, during undergrad, while I was at Vanderbilt University, Nashville, Tennessee, I had the opportunity to volunteer through a couple of programs at Meharry Medical School. And it was through that volunteerism that I learned about public health. Although I was a biology major and I was really focused on, just the study of biology, and I was really into understanding human biology more so, and would that lead me to medicine or dentistry or some other allied health profession? I wasn't quite sure. But I got involved in some public health efforts, and then upon graduation, I came back to Atlanta. It took about a year off just to figure out, what would be my next step. And during that time, I was able to volunteer at Grady Hospital, and actually in the STI clinic. And from there, I really saw the need for public health. I really saw individuals, girls around the age of 12 and 13 and 14 presenting with syphilis and gonorrhea. There was no education. They would just come in as they knew the drill, like just give me a shot in my hip so I can go on. We call it contact tracers now, but, as the nurses attempted to figure out, well, who infected you? And perhaps that person needs to come in as well. I learned a lot about social prestige and being able to, sit with this older guy and have everybody admire me and, but at what cost though, right? That wasn't really being shared or communicated effectively. And so I saw a need for, health promotion, health education among youth. So I really started looking into it more so, learned about the MPH program that had just gotten started. I think Dr. Blumenthal and Dr. Bill Jenkins, Dr. Janice Vaughn, and the list could go on of individuals who actually helped stand up the initial public health program at Morehouse School of Medicine. And it was unique. because I knew I wanted to get it more into public health and perhaps get a master's, and some of my friends from Vandy are getting MPHs as well. And so I, looked at the Emory program, and I looked at other programs in the region, UAB, Vandy, of course. And then I learned about Morehouse School of Medicine's program and the uniqueness of it, how it was not just focused on the formal training, but also the practical training. Like, okay, it's good to learn about health behavior theory, but how about the understanding the context for when to use those theories, or when to use this analytical framework or this research methodology. And so it was that combination of factors, I think, that really made me pursue Morehouse School of Medicine MPH program. And once I got in it, I mean, wow, I could only, I didn't understand the full extent of what I was getting into. And the instructors, the professors provided not only excellent formal classroom instruction, but then they were very successful in the grant space that allowed the students to go out and help collect data. And so I worked under Dr. Mary Langley, Dr. Elaine Archie Booker, and they took us to Southwest Georgia, me and a couple of my colleagues, Christy Brown, who's very active in the Alumni Association. We used to go down to Albany, Georgia and collect data for several of their grants. And it was just such a wonderful opportunity that, I still cherish to this day. And in part, that's the reason why I'm back as a faculty member.
Wow, that's amazing to hear, especially as like a current student. It's a lot of parallels between why you chose Morehouse and my story as well. Like, I agree, it's such a unique experience. It's so based on servant leadership and focusing on the underserved. And that brings me to my next question, actually. How did this program shape your personal mission within your career?
Well, I think this program was foundational. I learned things in this program that, prior to I guess I didn't really understand or I wasn't aware of, like this whole concept of health disparities. It was just coming out. Dr. David Satcher was with the Clinton administration as Surgeon General. And it was during his tenure that he passed this seminal legislation to establish the Institute on Minority Health and Health Disparities at NIH. That legislation really helped galvanize efforts nationally as well as locally toward this becoming a real field. And again, I think Morehouse School of Medicine MPH program was ahead of that, realizing that we have to address the Heckler report that came out in the 80s during Reagan administration that talked about the excessive Black deaths, right? And so Morehouse School of Medicine was already attenuated to addressing that issue. But I think once that legislation passed with, under Dr. David Satcher leadership, then you start seeing transformations happen across the country. And of course, Morehouse School of Medicine just grew in strength in terms of their ability to utilize this multifactorial approach to addressing health disparities. And so, I like the terminology that you use in terms of servanthood and, addressing the needs of the underserved. And, that's what I saw firsthand when I was at Morehouse School of Medicine. I did my practicum at Grady Hospital under the tutelage, as well as Fulton County Health Department under the medical director at the time, Dr. Otto Ali Troutman. And again, I saw firsthand some of the key issues that, I guess historically, I was not aware of. And so understanding the practical side and of course, the formal education was increasingly important as I matriculated through the program. And then that became the foundation that I built from. So I went to UAB and I still continued to work prostate cancer disparities, what I did my master thesis on. And then when I went to Texas and doing a postdoc, still focused on prostate cancer disparities. When I got recruited to the faculty at Moffitt Cancer Center, an NCI designated cancer center, I still focused on prostate cancer disparities. And as you very well know, prostate cancer disproportionately impacts African-American men at alarming rates, even to this day. And this is a cancer, when found early, is 100% curable. So, there was a lot of work that needed to be done and that remains to be done. And more recently, I've really expanded the scope to focus on cancer health disparities. And so Morehouse School of Medicine MPH program was extremely important in just giving me that foundation. At Vandy, I never even heard of the term health disparities.
Wow.
It wasn't until I got into this program here at this institution, Morehouse School of Medicine, that I began to understand the needs that exist. I always wanted a career that I can have fun in, that is something the work that I can enjoy, I wouldn't get bored with, and also make an impact, right? And I think that's what everyone sets out to do. How can you make an impact? And it's my involvement and matriculation in this program really afforded me that opportunity to position myself to do just those things. Similar to you, I take it, right? That's why you
Yes,
signed up. That's why you're here.
absolutely. It really is. Servant leadership is everything to me. So,
That's a great
Morehouse,
perspective.
yeah, because why would I do training just to serve myself?
Right. Now, are you
No
from
point.
Atlanta? Are you from the Atlanta
No,
area? Okay.
no, I'm from Michigan and then I went to Howard. So,
Okay. Oh, wow. I see. Okay. All right.
yes. All right. So, my final question will be so many amazing things you touched on, but I guess as a rising public health practitioner, is there any advice you would give to me and other MPH students?
Sure. Stay connected to the MPH program. Hopefully, you will continue to build long-lasting relationships with your colleagues. I still keep in touch with a number of my colleagues. Some of my best friends came out of my cohort. And then stay in contact with the program, always looking how you can give back and how you can help expand and grow the program. But then even going forward, as you begin to decide on, your career steps and your career trajectory, continue to do an evaluation of the landscape that's forever changing. I think you and your cohort are in a very unique position as we find ourselves in this pandemic, which is clearly a public health issue. And
Yes.
so, you ask yourself, after this pandemic is over, what will the public health infrastructure look like? What will be necessitated as a public health officer in this new normal? How will healthcare delivery change? How we administer public health services, how will that change? Right? And so all of these things you have to be cognizant and aware of, because I think it's going to inform your next steps, whether it should be, MPH coupled with another degree, whether in medicine or law, or even further in public health or research degree such as a PhD, or if you want to go into academia or industry or government or some hybrid. All these things are important, and I think the landscape bodes well for some combination of those different elements, where it's not just, this is who I am, I'm this epidemiologist for the next 40 years, but there's a lot of room in public health. As you know, it's comprised of multi components, social and behavioral, environmental health, health policy, maternal and child health, all different elements and very important elements that comprise what we call public health. And so, really deciding on what will this country need from us. More importantly, what would underserved populations need from us? We see how they're faring in this pandemic. We see where the gaps are. A lot of the health disparities have been amplified and magnified, and there's such a level of readiness at all levels of society in terms of doing something. How can we best make our impact based on the training we receive, in this excellent public health program here at Morehouse School of Medicine, and how can we be faithful ambassadors to that messaging?
Thank you, Dr. Rivers, for this impactful and candid conversation and taking the time to be here.
It's no problem. Thanks a lot, Tyler. I really enjoyed this conversation.
I did too. Hopefully, we'll do this again.
Definitely.
And to my alumni, if you would like to invest in students like myself, this program, and your legacy, text MSMLegends to 4144. Thank you again for tuning in. See you next time.